Good evening, Kentuckiana. I'm Bob Sokoler. My partner Kirby is on assignment tonight. And up first this evening, word of an increase in deaths and complications from a form of plastic surgery. Liposuction may be the fastest growing procedure in plastic surgery, but now some are asking, is it safe? Melinda Morrison is joining us tonight with more on the story. Melinda.
That's right, Bob. You know, last year, more than 150,000 Americans underwent liposuction, and 7 died from it. We consulted area doctors to learn why this is happening and help you learn how to prevent it from happening to you.
Not waking up. That was my biggest fear.
Donna Santa Cruz had routine liposuction, a fairly safe procedure, but she did have good reason to be afraid. Last year, there was a record number of deaths and complications due to liposuction surgery.
The medical expert is saying it was a series of tragic mistakes that led to Daniel Parrish's death.
The first death was reported in Boynton Beach, Florida last January. A 51-year-old man died after an 8-hour surgery. To find out why this is happening, we consulted 2 plastic and reconstructive surgeons in our area, Dr. Julian Samuels and Dr. Brad Calobrace. Both agreed that the advancements in liposuction technique, while being good, can contribute to the problem.
It has allowed us to take a lot more volume out with liposuction, take a lot more fat out during one setting, and with that, you're going to have higher risks.
So how do you choose a doctor? It is very confusing. After all, this publication has more than 13 advertisements for doctors who can perform liposuction. Perhaps there's a better way to choose a doctor. To help reduce the risks, we asked both doctors for some guidelines.
You want your surgeon to be board certified in plastic and reconstructive surgery.
Don't just look for board certification. You want board certification in plastic, and here's the key, reconstructive surgery. Not some other specialty where the doctor hasn't gone through general surgery and plastic and reconstructive training.
Are they qualified, and do they have privileges to perform that same operation in a hospital? Because the hospitals do an excellent job of really reviewing the credentials of that physician to determine whether they are capable of performing that operation.
There's also some controversy surrounding large volume liposuction, where you take out more than the standard 5,000 cc's of fluid.
It probably needs to be in at least in an outpatient setting of the hospital where the patient can be adequately monitored, and performed only by surgeons who have extensive experience with large volume liposuction.
And last but not least, listen to your doctor's requirements on what you need to have to be a good candidate.
I always think you should get a second opinion, but if you get multiple doctors that say no, 2 or 3, I think the answer is no.
Now, because of the increased deaths, and mind you, that 7 is not a lot, but the complications, too, the American Society of Plastic and Reconstructive Surgeons has assembled a task force to meet about these cases. And locally, Jewish Hospital has also set up a committee to look at their liposuction cases to prevent this from happening here in Louisville.
No, you're right. 7 is not a lot, but,
no.
But when you look at the complications that occur in addition to the 7, then there's room for concern.
You don't want any. It's not such a hard surgery. None should be happening.
All right. Thank you, Melinda.
Sure.
Well,